Morning to Michele Condit, the Chief Operations Officer of West Michigan Community Mental Health. You have the CMH behind you. It's a fantastic logo, but more importantly, it is a fantastic agency here in the area. And we just want to welcome you to the Morning Zoo. Good morning to you.
Good morning, Chris. Thank you for having us.
Absolutely. We get to talk about CMH in general today, but there are some initiatives as we get closer to 2026 that you are launching, especially that same day all access, that care that. And when you and I talked before a little bit, it's kind of like a clinic or hospital, sort of, where people can walk in and get service the same day right now. And I know I'm jumping ahead a little bit, but I love I want to preview this because it's an opportunity for individuals within the Mason, Oceana, and Lake counties to be able to come through the door knowing that in their mind they need help right then and there.
Mm-hmm.
And there's the services of the 24/7 phone call, 24/7 helpline is still there. Being able to see counselors and your team pretty quickly, still there.
Mm-hmm.
But this is just going to enhance things, isn't it?
Yes. So same day access it's a best practice in the behavioral health world. And so right now, when folks come to West Michigan CMH, like you said, anytime if someone were to call us in crisis, we have crisis services available. But right now, if folks want to come in and start services with us, they would come in or they would call us and we would schedule an appointment to start care. With same day access, what will happen is we'll have time available in all three of our offices that you mentioned, and folks can just walk in during that time, and we're going to start that process of engaging in services when folks walk through the door. So it will definitely create for more timely access. Like you said, when folks are ready and decide they want to receive services, we want folks to come through the door. We want to start that process right away. We know that folks who come in will feel more satisfied. They'll be ready to start care. And that's why our staff are here. We want to work with folks who want to come in and be seen by us. So our staff are really excited about rolling that out as well.
All right, love this. We're going to chat more about it, go more in depth in just a few minutes for those that are listening on air and as well those that are watching online, as we are streaming this on both of our Facebook pages and our YouTube channel. Today is an opportunity for the listeners and viewers overall to find out how CMH is doing, not only internally, but also obviously for the community and the number of people that you're able to invite through the doors and all over the phone and be able to serve in the community. And that really is kind of the core value. You have three principles: your core value, your purpose, and then obviously the dedication or the promise to the community. Let's kind of go over those, break them down for us, if you don't mind, so that we can, I'd say, rediscover CMH for those that maybe are not familiar with the agency.
Sure. So I think I'll start with our purpose. So our purpose as an organization is to help people lead their best life. And our purpose is recovery begins with hope. So our purpose as well is to help instill hope. So, and then what we do is we coordinate and we provide services for folks who have behavioral health concerns, folks who have substance use disorders, or folks with developmental disabilities. And then, in addition to providing services, we also collaborate with other organizations so that we can support whole person care for anyone who comes through our door. So that's really the purpose of why we're here in the three counties.
Do you find two questions I have for you, and as we go, I want to really lay this all out. And the first question is the resources that you do provide that you just broke down. Is that pretty standard? Is that where in West Michigan, in the Mason County, the Oceana County, the Lake County, that we have an agency that is superseding, that is reaching additional levels that of services that we wouldn't see on the other side of the state or a couple states away? Where do you feel CMH ranks among other agencies trying to serve the community?
Sure. So I would say that there are a couple of things that are different about West Michigan CMH. I would think the big thing is we're not only a community mental health organization, but we are also a certified community behavioral health clinic or a CCBHC. And so that is a certification that we received from the state. And what that means is that as an organization that we're committed to enhancing our service array, so expanding that service array. And we also provide services regardless of, I guess, what people's home community would be. So people can come and receive services from us, even if they don't live in our 3 counties. And we also work with everyone regardless of their ability to pay. So I think that CCBHC designation is something that makes West Michigan CMH stand out.
And you've been with CMH for a while now. When that changed, or was that? I mean, there was a point where that didn't happen, and it was sort of a game changer for being able to help so many others. Do you remember that moment? Can you give us a little bit of comparison?
Sure. So I would say when I think back before we were a CCBHC, I can remember, and I know we're going to talk about this later, I can remember a time across our 3 counties when it was pretty typical that we would serve maybe slightly more than 2,000 individuals per year. And I know we'll talk about that more.
Mhm.
And we're actually serving more than 4,000
Yeah.
individuals per year now. So I would say it's probably been about 10 years since we started and kind of headed down this path of being a CCBHC.
Mhm.
And so over that time, we've done a lot in terms of expanding our service array, expanding our service hours. So we've just done a lot of things over that period of time to be able to increase access to our services, to be able to expand our access, and to really work on reducing barriers to receiving services. And we wanted to spend a lot of time on stigma, on breaking down the stigma associated with receiving services from us.
If you're just joining us, we're talking with Michele Condit, Chief Operations Officer, CMH. Uh, Core values,
Mhm.
purpose, and then promise. Have we highlighted all three in a way that you feel effective and getting that information out to the community, or is there more about CMH?
So I think that our values and our promise are both really important. So we talked a little bit about who we are as an organization, but our values and our promise are really that foundation to
Mhm.
who we are, to that purpose. It's how we go about that. And the values and our promise to the community really are what drive our decision making, and they drive our actions as an organization. So I think our values are really important to share with folks. And first and foremost, we believe that everyone who comes through our doors has the ability to renew, rebuild, and recover. What
Mhm.
that looks like for everyone is different, but our belief is everyone has the ability to do that. We strive for excellence as an organization. We demonstrate integrity in what we do, and we honor and respect diversity and uniqueness. So we mean that that's important to us for our staff team, and that's important to us for everyone that we serve. And then I think it's important in terms of the promise we make to our 3 counties, kind of tied to that, is that we offer experienced staff.
Mhm.
We have a staff team of about 180 staff across our 3 counties. And I would say that we are very blessed with a very skilled and diverse staff team.
Mm.
So we have folks with lots of licensures, we've got folks with certifications, we've got folks that are very strongly trained in evidence-based practices. So I think that is definitely a standout area for us. And I would say that, I mean, just to give folks a sense, we have nurse practitioners, we have nurses, we have master's trained staff, we have bachelor's trained staff, we have counselors, we have psychiatrists, psychologists. So we have a very diverse and a very skilled team to be able to wrap services around every individual who seeks services from us.
And 180 roughly staff members.
Mhm.
I didn't even know that or have that perception of CMH, but you have you definitely have a large footprint of
We
helping.
do.
I mean, 4,000 plus people. That's a lot of people a
It
year
is.
when you look at it. And we're going to break down some of that
Mm-hmm.
and look even at the last 5 years, 4 or 5 years of history
Mm-hmm.
there and where you're at today.
Sure.
You'd mentioned the three counties, Ludington. You have an office, Hart, and Baldwin. Take us through a little bit of that, connection. Obviously, those are major city hubs in each of those
Mm-hmm.
three counties, and that's where you can, help individuals in the immediate area. But you have people that come from every corner of each of those counties.
Yes, we do. So we have an office here in Ludington, 920 Diana. We have an office in Hart, which is 105 Lincoln, and then we have an office in Baldwin, which is 1090 Michigan.
Mhm.
And so any one of those offices, folks can walk in at any time and request services from us. Folks can also call us. We have a 1-800 number. That number is 1-800-992-2061. So folks can reach out to us at any time. That phone number that I just gave you is answered 24 hours a day, 7 days a week, 365 days of the year. So anyone who needs us can call and that phone will be answered. And I think it's really important because I know several folks have not had opportunities to come in and see our buildings. And sometimes I think folks wonder, what do
Yeah.
your buildings look like? What's going to happen when I get there? And we have beautiful, very warm and welcoming buildings. I would say they look very much like other professional offices that you would go in. And in every one of our buildings, as soon as you walk through the front door, we have some folks, very warm, welcoming folks. We call them our customer engagement staff. Our customer engagement staff are sitting right by our front doors and will greet you when you come in, ask a couple of questions, and can get you directed where you need to be. So it's a very simple process for folks to reach out to us.
Mhm. When you were just saying that, I have a question, and
Mhm.
going back a little bit, you mentioned early on in the conversation a few minutes ago about, and I can't remember the exact words you said, but it was sort of adapting based on what the community has brought to you, walking through the door, phone calls,
Mhm.
all of that. Um, has that been I guess the question is it a regular part of CMH to say, okay, hey, this happened, let's adapt here, let's adjust here, let's put those individuals at right at the entrance so that somebody is able to engage right then and there? What has that been like over the years to listen to the community and adjust in sort of real time, right?
Sure, sure. So we do a lot. We gather feedback lots of different ways to make those kinds of adjustments. Of course, there's always um, new initiatives that come out that we evaluate, and we evaluate all of those relative to those foundations that we were talking about.
Mhm.
But we have a group of folks, we call them our consumer advisory panel. So we have a panel of folks who have a lived experience, who provide us ongoing feedback on our processes, experiences, so that we can adjust and enhance that experience that folks have when they receive services from us. We also do a lot of surveying, satisfaction kinds of surveying
Mhm.
of folks who receive services from us. So we take that feedback very seriously that we receive, and we make those adjustments as we can within the organization.
And you feel like obviously the positivity, the energy that I see in what you're saying today kind of shows me that you're in a good spot. CMH is in a good spot to really help the community, and we see that in the numbers. Again, we're going to get to
Yes.
that point of it, but do you feel like things are everything is greased pretty well, and things are going well?
Yes, yes, absolutely. We are very excited about the work we've done over the last few years to break down barriers to receiving services, to increase access, to increase our service rate. We are very excited. But that said, I mean, we talked a little bit about we strive for excellence. We talked a little bit about all the places we get feedback about our services. So, our work continues in
Yeah.
that area.
That leads us into sort of the next side of things, and just for the listeners, you'd mentioned the telephones available. We're going to be talking about the same day access,
Hmm.
um, but the BHAG and barriers. You're going to have to break that down for me because I know that's
Sure,
an acronym.
it is.
And let's kind of just roll right into that if that's okay.
Sure. So, as part of our strategic planning work, West Michigan CMH had just wrapped up a 5-year strategic plan. The goal that we had, or our BHAG, which is our big, hairy, audacious goal,
There you
is
go.
so
Okay.
that's a West Michigan CMH acronym, but that was our goal. So the goal over the last 5 years was for us to do all of that work that you and I've been talking about, but really focusing on sticking with those foundations we talked about, who we are as an organization and the purpose, but really doing that work that we need to do to increase access and break down those barriers to receiving services. So, over the last 5 years, our focus has been on doing just that. And the way that we are measuring, one of the ways, there are a number of ways, but one of the ways we measure how are we doing at breaking down barriers, increasing access, and meeting the needs of the folks we serve and our communities is by monitoring the number of individuals that we serve.
Yeah.
So, that BHAG.
And let's dive right into that because when we
Sure.
go back to 2021, again, we're dealing with COVID still a little
Yes.
bit there, and it's it spikes over the last few years, but really, you're looking at that number, which was what 3,250.
Hmm.
And that year, you superseded your goal that
Yes.
year. Did that mean, hey, let's raise the bar extremely high, or was it okay? This is realistic. Let's keep on this same path, and continue to obviously reach more people each year. And which you have. I mean, I think
Yes.
that's a big part of it. Is that the last 5 years CMH continues to serve more people in the three communities every single year. That
Yes.
has to be a good feeling.
It is, absolutely. And I think, Chris, we've talked about, same day access is kind of this next initiative for us as an organization to continue that work. But there are several things that we've done over the last 5 years that have really helped us to expand in the way or to increase access. And so some of those things that we've done is we have increased our use of evidence-based practices. So evidence-based practices are, I guess, modalities or ways that we do our business that are based upon research.
Mhm.
So we know that if we do business in that way or provide a service in that way, that we are likely to have good consumer outcomes. So over the last 5 years, we've increased our use of different evidence-based practices. We've done a lot of work on supporting our staff team. We couldn't do the work that we do as an organization as well as we do it without our great staff team. So we've spent a lot of time building our staff team. We've implemented lean principles within our organization. So we've increased our communication mechanisms. We have a suggestion system so that our staff team can make suggestions about how we improve our operations. Um, We've increased our substance use disorder services. We've added new providers to our panel. So there are some services that we don't provide ourselves,
Mhm.
but we have relationships with others to help us do that. So we continue to increase those relationships. So we've just done a lot of work over the last 5 years that we're very excited about and have helped us to continue to move forward to reaching more people in our communities.
Has there been, and obviously there has, but if you can elaborate on them with the increase in services, or you mentioned the evidence-based
Mhm.
research. Because when you were saying that, I was thinking, okay, you could go in as an approach of inventing the wheel, right?
Mhm.
Or
Mhm.
you can come in as, these are things that are working, that not only in the West Michigan area, but throughout the nation and
Mhm.
sometimes throughout the world. So really, it sounds like you're taking what works and making sure that that helps you streamline things to get to the
Yes.
end goal, right? The end goal is helping that individual get through whatever they're going through, or at least
Abs
to the next step.
Absolutely, yes. That's absolutely accurate. Yes.
Do you see that you still get, though, staff feedback? It sounds like,
Mhm.
where, hey, I was working with somebody here, and this seemed to help. Do you
Mhm.
think that we can work that in? Those conversations happen all the time too.
They absolutely do. So we have several ways that we can get feedback from our staff team about exactly those things you're talking about. So we do have a suggestion system where any team member can make a suggestion that then we evaluate for whether or not we can implement that, and whether or not that, kind of aligns with our purpose, aligns with our foundation, and does that help us move our work forward. So we have that suggestion system. We also send out a survey to all of our staff team every quarter, asking for particular kinds of feedback from them, and then we take that feedback and implement it. And then we have just regular, also kind of, I guess, communication mechanisms as well. Individual meetings with staff, we've got team meetings. So there are lots of ways that we get feedback from all members of our staff team so that we can continue to enhance our services.
I'm going to put you on the spot for just a moment, and
Hmm.
for the listeners that are, and the viewers that are connected with us, we're talking with Michele Condit, the Chief Operations Officer, West Michigan Community Mental Health. In these, when you've added these services over the years,
Hmm.
there has to be those moments, probably on a regular basis, that you look back and that person has called or reached out, or a family member has reached out and said, do you offer this? Because we have an individual going through this, or I'm going through this.
Hmm.
And the year prior, you didn't have that, but
Hmm.
now you do. What has that been like specifically? Or even, and I know you can't be, too specific on cases, but
Hmm.
there has to be some of that kind of breadcrumb that has happened over the years that you look back and say, we didn't have that last year, but we have it now.
Right. And I think there are lots of examples of that, Chris. I mean, thinking about when we talked a little bit about how West Michigan CMH became a CCBHC, that
Mhm.
provided opportunities for us to expand our service array to services that we didn't have previous to that, which is why some of our opportunities, because we continue to evolve as an organization, and because what we are able to provide to the community continues to evolve. That's why some of these opportunities, when you let us come and engage with you about new things we have happening, when we're out in the community, we just look forward to all the opportunities that we have to be able to talk to the community about what's new. Because yes, if someone came through our doors 5 years ago or 10 years ago, we are a very different organization today than we were then. And we really want to get that information out to our communities.
Speaking of 5 years ago, you were at 37 or 3,200, just over that, those individuals in the communities you're serving. Where are you at now?
We are, I just want to make a quick look, make sure I get this right, but the last time we ran the data, we were at about 4,400 individuals served for the
Wow.
last fiscal year. So we are very excited about that.
That's great to see that, and
Mhm.
again, there's some pride behind that. There is,
Absolutely.
because when you are, everything that you're doing is looking to help an individual out there within the
Yes.
community, and I think that that says a lot. Anything we missed, I guess, in regards to the growth of CMH over the last 5 years that you want to share before we we have a few more points I want to get to before we wrap up. But what's been the last 5 years that we've missed, if you don't mind sharing?
Sure. I think one of the things I really wanted to share is we've talked a lot about how we've get feedback from our staff team about how to enhance services, and we do that same thing. We do get feedback from individuals that we serve
Mm,
about how to enhance our services as well. And one of the things we do is we collect satisfaction data with our services from individuals served. So I think it's really important that not only are we growing and evolving, but that folks are having positive outcomes and that folks are happy with our services. So
mm,
one of the things we do is on a monthly basis, we provide an opportunity for individuals who are served to fill out what we call an NPS survey. It's like a satisfaction survey. And for the last several years, our consumers have told us that they are very happy
mm,
with the services they receive. So that tells us that we have at least the right balance
mm,
between the services we're providing and the experience that folks are having within the organization. And I think one of the other things that's really important is in addition to satisfaction, it's really about outcomes as well. Do folks feel like that they're feeling different or they're feeling better after they've had services from us? And one of the things that we're really proud of as an organization is, as part of being a CCBHC, we report on a number of we collect data and report data on a number of clinical outcome measures.
okay.
And for the last 2 years, West Michigan CMH has met the target.
Mm,
So across the state, all CCBHCs in the state have to collect this data and report on this data. And for the last 2 years, West Michigan CMH has met or exceeded the target on all of those clinical outcome measures. And the first year, we were the only CCBHC in the state at
wow.
that time to have met those targets, met or exceeded those targets. So we're really proud of the fact that, again, not only are we enhancing the services we're providing, the folks who are receiving those services are very happy with those services, and we're seeing great clinical outcomes.
Mm.
So across the board, we're just very happy about that.
And I looked at the chart as you were talking about that. I looked at this chart that you shared with us in particular to that, and especially in the last since April or uh, no, August of this year, in
Mhm.
that last just few months here in that quarter, that has skyrocketed in regards to that. So it looks like you're definitely keeping a close eye on that to make
Yes,
sure that people are pleased with the services as well as getting the results that they're looking for.
absolutely. Yes.
If you're just joining us, we're talking with Michele Condit from West Michigan Community Mental Health. Michele, I know we've dived into a lot of areas of CMH, and for the listeners out there, I'd like to go a few more minutes because there is some very important areas we want to focus on, especially that new initiative that you're launching in January.
Mhm.
So, as long as you don't have a 9 o'clock meeting, can we chat for a few more minutes? Do you have that time?
Yeah, you bet. Yep, be
Okay.
happy to.
CMH is doing a lot. You had this conversation with us here on the radio and as well as our our socials. But you and your team are doing a lot on your social media. You're out in
Mhm.
the community. I see photos all the time shared at
Mhm.
this event. I just saw the other day that you were in Oceana County. The team was in Oceana County for a conference there. There is a lot that you're doing as outreach, and rather than just sitting back and waiting for the next consumer to come through the door, next person to come through the door looking for services.
Absolutely. So last year, we participated in about 60 different community events, including, meeting with you. We try to attend or participate in as many events across our 3 counties as we can. Those are great opportunities for us to interact with the community, to educate the community about the services we provide. And sometimes those events, I guess, are a little less formal. People people feel a little more comfortable about coming up and talking to us and learning who we are. And you're right, we have a big social media presence on Facebook and LinkedIn. And I would encourage folks to kind of follow our page. There's a lot of good, I guess I would call them tips, tricks,
Mhm.
information about us as an organization. But I know one of the other things we talked about is sometimes folks are apprehensive about coming into the organization. What will it look like when I get in there? What will I experience? But I think one of the other kind of fun things I think on our social media pages is an opportunity, like you said, to see pictures of our staff team.
Mhm.
Not only engaging maybe in some of these community events, but we do have um, monthly, we highlight a staff person.
Mhm.
There are often photos about maybe informal kinds of things that we do as a West Michigan staff team in the organization. So I think those are great opportunities as well for folks to kind of follow our social media page and get maybe a sense for who we are as an organization. And I think that has been helpful sometimes for folks to see pictures of this is who I'm going to see when I come through the door, or, oh, that's my friend, that's my neighbor, whatever. So I think that's been kind of comforting for folks. So I would encourage folks to keep an eye on our social media pages as well.
Yeah, this is great, and you're doing fantastic. And again, the sky's the limit. So we're going to have a conversation 3 months from now, 6 months, a year from now,
Mm-hmm.
and see that there's even additional services that we didn't even
Yes.
think about, or you didn't know. Like, hey,
Right.
we can add that. So that's a good thing. One of those services you have already started to put the foundation in place, and excited about that, and that is the same day access that CMH is going to provide. That's taking place in January. Do you feel you're ready? Break it down for us. Where are you at?
Sure. So we are well on our way to be ready to implement in January. So same day access is a best practice in the behavioral health industry. So same day access, and I know you talked about this a little bit, Chris. It's like you mentioned, like walking into your doctor's office or walking in to any other office. So right now, today, the way our process works, if someone is interested in receiving services from us, they would walk in or they would call us and we would schedule an appointment for a few days out to get that process started. When we roll out same day access, when we will just have times and we'll make sure that we publish those so everyone knows what those times are. But we'll have times across all three of our counties where anyone interested in receiving services from us can just walk in during those times. And rather than get an appointment scheduled, we're going to start that process right as folks come through the door.
Okay. And so is can we put out there that from an expectation standpoint, that if somebody is struggling right then and there, they're not going to and I don't want to use this term as a negative, but they're not going to be shifted off slightly to say, okay, we need to set an appointment from a week from now or 2 weeks from now. They're going to be able to get some form of services to kind of settle things down if they are
Mhm.
in a really bad situation, or feeling this way or that way.
Absolutely. So part of that, when folks come through the door, or if folks call us, we'll let them know, hey, come right on in, and we'll get you right into that process. So a part of that will really be evaluating when folks come through the door, how urgent is that need, and if it's very urgent or a crisis situation, that will be handled in that way. If it's a routine request that folks just want to start receiving services from us, then it will go that path. But yes, our plan is not that we'll be scheduling appointments. Folks will come in and we're going to make that decision right away. And then we're going to get folks started in that treatment process.
Why is this is a very positive thing, but
Absolutely.
has it been where you have what led up to this? That's my question that I would like to ask, if that's possible, because obviously this is a very it's additional model to
Hmm.
CMH,
Hmm.
but it's definitely not just, hey, we're adding a service. We're adding there's a lot of function that goes along with this, and a lot of resources that have to be available during
Yes.
that time as well.
Yes. So this is really all part of that work, Chris, around reducing barriers to receiving services and increasing access to services. So this is, as a part of doing that work and as a part of our strategic work, we look at different kinds of initiatives that are those things that will get us the outcome that we're looking for. So that outcome of increasing access, more timely access to care, all of those. So as we set that as our goal for the last several years, same day access is just another one of those evidence-based best practices that we've done that research. We've brought in a consultant to help us roll that work out, and that's our next big initiative.
Do you see that you're going to see better results from this? Is that, at the end of the day, that results is what you measure, but also what
Yes.
every consumer that comes through the door measures. Like, okay, I've gotten past that hurdle, or I feel better in that area. Um, do you see that there is, again, evidence based, because that is what
Mm-hmm.
we talked about earlier,
Mm-hmm.
that this is a nationwide thing that is happening out there, or has been happening?
Yes, so there is a lot of data that would suggest, and just like for you and I, for anyone who would come in, at the point that I make that decision, and sometimes it's hard for folks to make that decision or to make that first call to us or to come into our building for the first time. At the point that folks do that, the best outcomes and the best satisfaction for everyone is if we can get started right away. So, and we know that folks that are served are going to be much happier with being seen more timely. Folks will be able to engage differently in the services if we can get started right away, and then we don't do a lot of appointment scheduling is sometimes tricky. Reaching folks by phone, I mean, folks are working, whatever. Sometimes it's hard to reach folks by phone. So when they come in, we just take that opportunity in January. When folks come in, we'll take that opportunity. We're going to get started and just get that whole process started right away.
All right. Do we have a date at this point when this is going to roll out, or still a little bit more things to take place before that?
We do not have a firm date, but as soon as we do, we will make sure that we get that communication out to the community. But it will be January. We just don't have a firm date. There are lots of things we need to do in the organization. You talked about resources and our processes and those kinds of things. We want to make sure all of those things are ready. So when we say we're ready for same day access, that the whole organization is ready for that.
All right, looking forward to this, especially another top of our conversations that we have when the snow is on the ground. We don't want to talk too much about snow, but we will see that, and that is the depression factor that takes place during the
Hmm.
winter time. So this could be a really good opportunity for
Hmm.
individuals that are kind of alone or less,
Right.
socializing out there, to be able to
Hmm.
find and walk into a resource that they can kind of explore what they're going through
Sure.
in real time.
Sure. And I think, Chris, one of the things as we're talking, even before we get to same day access, um, now or when we get to same day access, if anyone is wondering whether or not, I think sometimes folks wonder, I don't know if I should go to West Michigan CMH. I don't know if they have anything to offer me now, and even at during same day access. I would encourage everyone who has that question, call us or stop in. If we're not the right organization to help meet your needs, our staff team are very knowledgeable about other community resources, other resources. So if we're not that right organization, our team can connect folks with that right organization. So I would encourage anyone who's kind of wondering about should I or shouldn't I, give us a call or stop in.
Great information there, especially to be able to say, oh, we don't have that, but here is somebody that will be able to help. And
Yes.
it's not like retail where, oh, well, we don't have it here, but you'll find it at a different store somewhere else. No, we
Yes.
have
Yes.
partners and
Hmm.
relationships that will get to that, and that says
Yes.
a lot about CMH and the ultimate goal of looking out for those that come
Hmm.
through the door and call. Uh,
Yes.
I don't know if we have anything else to chat about in regards to this. I know we covered a lot, and I wanted to do that, and I know your team wanted to do that as well,
Yes.
to be able to just share this with the community that there is
Mhm.
a resource out there,
Yes.
and bringing a little bit more light to it. Michelle, anything else to add before we wrap up today?
No, just a sincere thank you for letting us be here to talk about this today.
Well, thank you for providing these great services, and
Sure.
these additional services on the way for 2026.
Mhm.
Michelle, we will connect with you in the future,
Yeah.
and for those that may have missed a little bit of the segment or want to watch it in its entirety, you can find it on our Facebook pages, WMOM and Hot Country Hits, as well as our YouTube channel there as well. Michelle, thanks for being a part of the
Yeah.
conversation today.
Thank you.
You're welcome. It is 102.7 Mama FM.